Today is 6:25. Okay. Okay, so now if I go to the campus login, little getting confused now. 6:14, 6:14, 6:14 all are present, right? 6:14, save. 6:14 near for 6:24. 24. Okay. What is her name? Alexia. Okay, save. Okay. Now let me see the team. Okay, what is Sabana? Louis went to the washroom. Okay.
I'm here,
Cara.
ma'am.
Okay. Okay. So Chris is here. Joanna. Fazado. Okay. So Amina. Junaida. Venus. Alexia. Esnet. Yusra. Huda. Inghang. Bharna. And who is the last? Santiago and Christiana. Okay.
Miss, I'm here. Sorry, I was in the washroom.
I know. Okay. I can see you're here now. You can see Christiana. So basically, oh my God, after a long decade, everybody is present. How come? So present, easy for me. So this is present, so I can close this one and then can do the attendance and then we can start. Good job. So these are all are present. Take 25, right? Save.
Ma'am, sorry to interrupt.
Yes, what happened?
Tomorrow, I think Asinet also will be having our mask fit test in school.
Yeah.
Will still be online. I will still be online, but
Yes, me too. Yeah.
Yeah. Starting at 9 o'clock.
So you are going to be joined from there, right? That's what you're telling?
Yes, ma'am. Yes, ma'am. We're going to Anderson to the campus.
Okay.
Mine is at 10:30, but I'll be online too. Thanks, Evelyn.
Yeah. Yeah, okay, Masina. Thank you, ma'am.
All others are done? All others
Um,
mass intestines are done?
maybe not, ma'am.
Me, I'm not yet, ma'am.
So when they're going to do it, did you ask them?
You're doing it.
I will need to ask another schedule again.
They're doing it on the 26th and the 27th. The 27th is on the North York campus, and the 26th is at Anderson at Mississauga.
Mississauga, yeah.
Sorry, what is that again?
Mask
Mask
fit test.
fitting.
That's
The what?
for
Sorry?
our placement. I think everyone who will be going to hospital will have that mandatory mask fit.
Oh, okay. For only people who are going to the hospital for their placements, right?
I think so, but I'm not too
Okay.
sure.
Hospital is mandatory, 100%. But I
Yeah.
don't know about the clinics, what they're doing now. The hospital,
Yeah.
you have to wear the mask always. Yeah.
Mhm.
Okay, so.
I
Okay, so
haven't had
this.
my placement yet, so I'm not too sure yet, but I guess Miss Suzette will let me know.
Yeah, me either, Christiana. I didn't get any notification about anything like that.
No.
Yeah.
Mm.
Okay, so let us start. So we are going to start from this slide. I think slide number 40. I don't know which how to show that one. This looks like 40. Okay. So we have learned about the whatever we did the revision with the whole class yesterday for 4 hours. Now regarding you guys already learned how to do the preparing materials for autoclaving. Just to refresh, fluids never ever overfill to the top because you need first of all good airflow, and also with the high temperature the liquid may overflow in the autoclave and the volume is be less because it's the high temperature, right? It's going to start boiling and then maybe overflow. So large flasks do not fill to the top. Separate flask for good airflow. So separate each flask in the different with a distance. Dry goods, you can wrap with the muslin because it has the good steam penetration and can stay sterile. Allow good horizontal and vertical separation. Which needs to be horizontal, keep them in that, and otherwise try to do in the vertical position. Fundamentals rule: load material in such a fashion to present the least resistant passage of air exchange through the hole so that air can move freely everywhere, because it is the principle that steam under pressure. So air needs to be moved around freely. About crowding or stacking, if you crowd or stack one over another, air is not going to be penetrate, which is carrying the steam with high pressure. Place packagings on their edges to enhance steam penetration. Place a rack or rather item against this item. So you can have the vertical bars and place the items on the side so that you can get the and the edge so that it can get the maximum penetration of the steam or air. For loads which are mixed fabric and hard goods, place the hard goods on the bottom, which is hard good, to prevent possible condensation from dripping onto the fabric. So place empty flask, test tube or other non-porous containers on their sides with loose covers. So you are not going to put them in the straight. You are going to put them in the side, and the covers should not be tight because it's going to break. So you have to keep the covers loose. This provides a horizontal pathway and prevents trapping air pockets. Ensure containers do not touch each other. This will ensure all surfaces are sterilized. No item should touch the top or sides of the autoclave. The jacket, it should not touch on the side or top of the autoclave as the container is pushed inside. Liquids and dry goods are processed separately. So you are not going to put the liquids and dry goods under the same cycle of the autoclave. You have to do the separate cycle. All the liquids, whatever is needed, can go one time in one cycle, and for the dry ones you can put another cycle, because sometimes they need the different cycle selections. Liquids may take for the sterilization, it may take 30 minutes, or the dry goods maybe 15 minutes. It depends upon, it's going to retain whatever is time is required for what type of sterilization of medias or any liquid. A load of liquid filled container should be of similar size, shape, content, and volume, because exposure time is based on those characteristics. So in one cycle, you are not going to put 1 liter flask, another 125 or 100 ml flask. If you are put the large volume, try to put the large volume, because it's going to time dependent. Large volume will take more time, and the smaller volume will take less time. And if you put extra time or something, it may cause problem. Break. Just hold on a second. Okay. So now run material to be sterilized separate from those to be decontaminated. That means we have already told that what is not to be decontaminated means already used, but you have to still do the decontamination from the pathogen or any infectious material before you throw it in the garbage bag. So you are not going to run the decontaminated materials and what needs to be sterilized for use in the same cycle. It should be the different cycle. Unloading autoclave. So first you have to open the pressure. When the pressure and steam came down totally to the zero, then wear all at the same time. So you are going to wear all the necessary personal protective equipments. The chamber pressure gauge of the autoclave should be zero. When they just tell you, when the autoclave is done, the pressure is going to be reduced. You need to off the autoclave, is going to go down to the zero. So until you put the zero, it's going to be huge pressure inside, and if you try to open it, it's going to prevent you to open. But in case you open, it's going to be huge hot air. You are going to get the steam burn. Crack door slightly and stand back to allow steam to escape. Slowly open autoclave door. Very slowly you have to open it. Even you do everything till you see some steam is coming out. So you have to stay little bit back and open the door slowly. And slowly opening the autoclave door is going to be, the steam is going to, like you do whenever you cook. If you open something slowly when it's boiling versus if you just open the cover or lid immediately, what is going to happen is suddenly the steam goes in your face, and if you just open the cover slowly, it doesn't. Slowly it become mixed with the air and it doesn't splash. So
Like
slowly,
pressure cooker.
yeah, slowly is autoclave is just a pressure cooker. Slowly open autoclave door. Opening the autoclave door too quickly may result in glassware breakage because sudden temperature difference, and also steams burn the skin. If boiling or bubbling is still present, sometimes even if zero temperature came down, but till inside temperature it holds. If you see till any liquid or anything is bubbling, wait. If you see, open the autoclave door slowly, everything, but till you see the liquid sorry, is bubbling, wait. When it becomes settled down, then you are going to take it out. So they bring the autoclave trolley to the chamber close to the that using heat resistant gloves, carefully transfer containers, pans to the trolley. You are going to take out when everything is cooled down, you are going to take out everything, bring a trolley. So you are not going to take one because these are all hot. Even is you release the zero temperature comes back to no steam or anything pressure, but still you can see it's going to be hot. So you are not going to take a one and put it in the table rack or something on the bench. So you have to bring a trolley. When there is a huge amount of things are getting autoclave, bring a trolley and put everything, taking out slowly with a heat resistant gloves, and then move the containers to a drug free area. If not already cool, wait 10 minutes prior to storing sterilized material or preparing autoclave waste for disposal. So basically it has to be cool. Whether you are going to store it, you have to throw it out. After every use, it is advised to close the autoclave door, but do not seal the door as it will shorten the lifespan of the rubber gasket of the door. So you are going to close it, but you are not going to lock it. So now you are going to check the temperature resistance, that the tape indicator, whatever you put it, whether has been changed its color or not. It will give you the basic indication that it has been steam has been achieved. The tape change in the color of the tape tell you the steam has been achieved. So if no change appears on the tape, the load is required to be re-autoclaved after placing new tape on the material, because the tape you are already used is exposed to steam. So during re-autoclave, you have to put a new tape. Also verify the cycle log recorder to check the temperature and time attained. So you can just see whether you should stay there until the pressure and the temperature has reached. But anyway, you have to check everything whether the temperature has been attained that time. Otherwise, why it didn't get autoclave? If minimum time and temperature is not attained on the second cycle, user should contact the person responsible for maintenance. So your first autoclave, you say it didn't work, the tape didn't work. Then second cycle, you are running, then you are seeing, washing whether the minimum that is running in the minimum time and most efficiently whether the temperature and pressure has been attained. If not, it's not acquiring the 121 degree, 121 psi, 121 degrees centigrade and 15 psi, then that means autoclave is not functioning properly. You cannot do any manipulation or take care of anything regarding the autoclaves. Contact your lab manager or your senior, and then they have to contact the maintenance. If the container that could be contaminated by liquid splash due to boil over or by direct contact with contents of the waste pack, such a melted agar should always be washed after use. So if there is anything spill, you have to use inside with the wipe and clean the autoclave before that. How it's placed in rack by rack, one by one, it's placed like this. So is one is not going to touch with another one, and there is space in between. And the heavy things will be down, the hard and heavy things, and obviously light things will be in the top. Preventive maintenance will greatly increase the efficiency of your autoclave, reduce downtime, and save costly repairs. It may be considered as a scheduled inspection, which could result in minor adjustment or repairs, major repairs, or premature replacement parts. It is designed to maintain safety and delay or avert emergency. So daily maintenance is important for all the equipments, not only for the autoclave. And if there is any problem, immediately report it so that it can be not getting further damage. Daily or weekly maintenance. All the manual will provide specific, each autoclave comes with the specific instructions. But what are the some general guidelines? Disinfect exterior surface of the autoclave. Always check door gaskets for wear if there is any wear or tear in the gas gaskets, because that is the gas gaskets is the main thing he's giving. Close the door tightly like the pressure cooker. We have the gasket ring. Clean interior walls with trisodium phosphate, other mild detergent as recommended by the manufacturer. Clean screen leading to discharge the line so that you can see it. Check primary and secondary containers for integrity like the stress, fracture, cracks, chip, etc. And consult manual to determine other recommended activities. Yearly maintenance, annual inspection for like majority of the instruments, they have to come and annually check the instruments. That is the duty of the organization for the quality assurance and quality management. All documentation is required to be kept or accreditation inspection purpose. So that's why you are always telling accreditation, 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 so that you are doing the daily maintenance. When you are using the autoclave, you are logging it, the temperature, pressure, whether raised it, who did it, for how long it did it, if there is any damage, any comments or anything, if there is anything there, nobody take care of that, or it has not been reported. It is not only for the autoclave, it is mandatory for all instruments. Then this is the autoclave dog, date, operator, contents of the load, what you have doing, liquid, large volume, small volume, solids, what type of solids, metal, glass, anything. And the test result, correction action taken. Corrected, you can see the test result, whether the tape has been sterilized, is it sterilized or not, yes or not. Autoclave hazards and steam and heat associated injuries. There may be, if you doesn't use the proper glasswares, it will crack. What type of glassware we can use in autoclave?
The bore,
Borosilicate.
Borosilicate.
And what type of plastic or glass plasticware we can use in the autoclave?
polypropylene.
Yeah,
Okay,
polypropylene.
good. Okay. So any chemical reaction may happen, any explosive decomposition. So there are a lot of, and biological hazard, obviously, if we are dealing with the biological materials. Unsatisfactory decontamination by autoclaves, inappropriate type of autoclave, insufficient temperature of the load, inadequate cycle time, incomplete penetration of steam due to improper loading, incomplete removal of air from the chamber. So these are all very important to make sure whether your autoclave functions properly. So these type of things can give you unsatisfactory results. Your loading is important, adequate cycle time is important. Make sure your effective temperature and pressure is attenuated. Before loading the autoclave, you have to remove the all air inside. It's not like you are sucking it. There is a button. So if you press it, it's going to release all the air was inside. And then you are going to do start the autoclave. It's going to start with the new steam and pressure. This doesn't need it. Filtration. Sometimes you can, some things are there which you cannot do any type of sterilization techniques except the filtration, because they are so sensitive. It cannot go anywhere, neither dry hot air oven, nor in sterilization or in the ethylene oxide. So that time there is some chemicals or some cultures or some mediums, it has to be sterilized. But there are a couple of, yes, sterilized can be done. Science has been really high technology now. Not now, this is for a long time though, but it's, yes. So this is the filtration. So in the filtration, this preparation of some microbiological media, the preceding methods of sterilization will result in deteriorations of the media. So like if you do the sterilization or any other method, whatever we have discussed, it can deteriorate the media component, so that for that you are using this media is not going to be effective for your purpose. So that time they use some membrane filter. What is the membrane filter? Is made up of plastic polymers or cellulose esters. May be used as alternate method of sterilization. Heat sensitive solutions such as vaccines, antibiotic solutions. Keep in mind, this can or make it, these questions come. So vaccines and antibiotics can be sterilized with autoclave, hot air oven, ethylene oxide, or membrane filtration. So it can be, these type of things, they are so sensitive for anything. So they cannot go any one of them. So that time they have to do the filtration. This is highly costly, this filtration. So you have to do the filtration. Filtration is a plastic polymer or cellulose ester, and which can block air of all pathogens. So heat sensitive solutions, as again vaccines, antibiotic solution can be sterilized by filtration. High efficiency particulate air, that the HEPA filters are used to filter the air in the biological safety cabinets we know. Isolation and operating rooms are used HEPA filters. These filters are capable of removing 99.97% of organisms larger than 0.3 micrometer. Radiology sterilization, where you have the radiation. So they have all this sterilization. They are doing mainly with the UV lights. So these are the biological safety cabinets. This is the laminar flow where you the UV, and this is the fume hood where you can make all the chemicals and others and solutions, so that nothing is going to come out, like the acid, alcohol, anything. You can use any chemical thing. So this is the difference. On the biological safety cabinets, you are going to use the HEPA filter, which can go protect your worker and the samples. Laminar flow is mainly working with the sterilization things. So microbiology laboratory acquired infections from aerosols. What is the answer?
D.
Hmm?
D.
Letter D.
Are associated with improper venting.
Improper venting of, yes.
Yes, ma'am.
Prevention of aerosolization can best be accomplished by
C.
Letter C. C.
good.
D.
C.
Done.
Autoclaves are an integral part of our microbiology and biotechnology laboratories. They are used for sterilizing glassware, tips, and media, and for decontaminating biohazardous material. When working with an autoclave, high temperatures and high pressures are involved, so it is essential to adhere to safety practices. Autoclaves should be regularly maintained and certified annually. With each use, additional safety checks should be performed, such as inspecting door gaskets for cracks and replacing as needed. Let's take a look at a proper, safe use of an autoclave. Keep in mind that you will also be trained on your campus's autoclave before use. Inspect all glassware for cracks and ensure that the glass is autoclavable. Do not autoclave compromised glassware. For liquids, leave the caps of the containers loose to prevent explosion, or cover with foil. Liquids should fill no more than 2/3 the total volume of the glassware, while media should be no more than half the total volume. Place glassware in an autoclavable secondary container. This will catch any spillover from the materials being autoclaved. For red bags, secure with a twist tie or autoclave tape, leaving an opening the size of 2 fingers to allow steam to penetrate the bags. Red bags should also be placed in a secondary container. When using autoclaves, don PPE, which includes goggles, a lab coat, nitrile gloves, and heat-resistant gloves. Depending on your autoclave, check the jacket pressure before running a cycle. Jacket pressures typically range from 15 to 20 psi. When ready, place items on a rack inside the autoclave. Do not place items on the floor of the autoclave, and do not block the drain. Allow enough space between items for steam to flow, and do not overload the chamber. After loading the autoclave, close and lock the autoclave. At Valencia, the model of your autoclave may vary based on your campus, and therefore you may encounter different door lock mechanisms. Select the appropriate cycle. If you are unsure, check with your lab supervisor or your manufacturer's manual. Typically, the gravity cycle is used for glassware, utensils, and biohazard waste. The liquid cycle is used for liquids as it has a slower exhaust to prevent boil over. Once you start the cycle, make sure to log the cycle information in the lab's autoclave log. Before opening the door at the end of the cycle, first check to ensure the temperature on the gauge has dropped to a safe range and the chamber pressure is at 0 psi. If your autoclave door swings open, stand behind the door and carefully open the door no more than 1 inch. This will release residual steam and allow pressure within liquids and containers to normalize. Allow the autoclaved load to stand for 10 minutes in the chamber. For other models, where the door opens outward and upward, step to the side and release the handle. After the initial burst of steam is released, push the handle up. Similarly, allow the autoclave load to stand for 10 minutes in the chamber. After the load has cooled for 10 minutes, cautiously remove the items as they will still be hot. Do not agitate liquids, as this may lead to boil over, which can cause burning or scalding. Leave the door of the autoclave slightly ajar. Resealing it will shorten the lifespan of the rubber gaskets on the door. Place items in a safe area to cool. Autoclaves are easy to use and can be operated safely as long as you follow these safety guidelines. At Valencia, autoclaves are operated mostly by prep staff to provide sterile equipment and media for labs, and to decontaminate biohazardous materials. Biotechnology faculty and students may also operate autoclaves, depending on the course. Before using any autoclave at Valencia, you should first be trained by the lab manager or lab supervisor at your campus. During this hands-on training, you will learn more about the specific model used at your campus. Talk to your campus lab manager or lab supervisor to schedule training if you anticipate using the autoclave.
You guys know the microscope. We already did this one, right?
Yes.
We already did this one, so it doesn't need to do that one. You know all the parts of the microscope.
Yes.
We are not
Yes.
repeating it, okay? So because
Okay,
everything you
ma'am.
know, yeah, base, arm, stage, what is the condensation, what is the objective, how you do the magnification, what is the magnification? If you have use the objective 20x, what is going to be the magnification?
200.
Why 200?
Times
How
10,
you-
ma'am.
Huh?
Times 10
10 from where?
from the oculars.
Eyepiece.
Eyepiece.
Yeah.
Yes,
The
good.
eyepiece. Yeah.
Which type of illumination system we use?
Kohler.
Okay. What type of
Kohler.
microscope we use?
Bright field.
Bright
Bright
field.
field.
Yeah,
Good.
bright
Good.
field.
Good. Who controls the aperture of the light?
Diaphragm.
The
What is the name of
diaphragm.
the iris diaphragm?
Iris diaphragm.
Iris diaphragm. What is the oil immersion magnification?
100.
100x.
Where is eye or objective?
Objective. ma'am.
Objective.
Where do we put the objective? What is the name of that area?
That's the.
Is above the stage.
What is the name? Nose.
Nose piece.
Oh, nose piece.
Yes,
Okay.
nose piece.
Okay. So you now the whole lower objective, higher object. So I'm not oil immersion. This is bacteria can be seen only by the oil immersion. You can focus it, but to see the individual bacteria, you have to see the oil immersion. When you are going to stain the gram positive, negative, then we are going to see it. What oil is used, we have learned that is to increase the numerical aperture, is called the Na, that the resolving power of the objectives become more clear, and you can see, the adjusting system, coarse and fine knobs, right? On the side, yes or no?
Yes, ma'am.
Okay.
Yes, ma'am.
Okay. The iris diaphragm. It controls the aperture, how much
Yes.
light is going to be passed. So this is the iris diaphragm. You have seen this one. So it's going to open. How much light is going to be passed to
Dilates
see
and
the.
constricts.
Yes. So okay. We use the bright field illumination system, right?
Yes.
Different types of microscope: phase contrast, interference contrast, polarized and compensated polarized, fluorescence, dark field, electrons. In general lab, we use the dark field microscope. These are the specialized microscope, okay? In the lab, dark field. Illumination system begins with the source of light. So you have the light at the bottom, right? And then the light goes through a aperture. You can operate the light switch on and off. You know that. And then you can light intensity controlled by a dimmer switch to rheostat. You can control the light. It depends upon everyone's eye, how much light you need to see clearly. It depends upon your eye power and eye
Your vision.
sensitivity. Yeah, vision. Yeah, and then you can control that light, how much you need. So it's a light. Then you have the condenser lens, which is condensing the light from here. Then it is going to the iris diaphragm. Then you have the specimen on the stage, and this light beam is passing through, and you are seeing between the combination of the eyepiece and the objective lens.
Yes.
Yeah. Cochlear illumination system. It is the transmitted to reflect light. That is, this is objective lens stage. You guys know now everything. This is the iris diaphragm. It's from the down. This is the yeah. This is the knobs, macro, micro. This is the iris diaphragm. Here we have the condenser. Where the light is coming, it is condensing and then is passing through the iris diaphragm. These are the comparison. So, any question about microscope?
No, ma'am.
Mhm.
No, ma'am. Thank you.
What is this one? Welcome the virtual microscope. Select an option from the menu below to use the resource guide. Learn more about the microscope, explore or test your knowledge. I don't know how long it's going to take. Let us. You have seen the microscope by
Ma'am, it's
yourself.
Shabana.
Yes.
Sorry, ma'am, I need to just take my little one for a quick checkup for to see if like his infection is getting better. But I will be online throughout though. Just wanting to let you know.
Okay. How long yours going to
Thank
take?
His appointment's at 10:30. It shouldn't take more. The clinic is right by my house, so it shouldn't take more than 20-30 minutes.
Okay.
Yeah.
Okay.
So I'm gonna yeah, but I will be online. So if anything, I'm gonna be responsive as well. So I am still online throughout. And my video will be on as well.
I don't think this is anything useful. You can just close it, right? I don't know. They are just going, what
Yes,
is.
ma'am.
Yeah, I
that's
think it's
just
going to just take
it's a
wastage of
waste.
time. Wastage of time.
Yeah.
Yes. We have learned. Okay, so this have you already learned this one. This is this is for reading. It doesn't not that much important. You know whatever. This is for reading, extra reading. Okay. Same thing. What is the ergonomics? How we are going to see it? Chunks. No clutter around the legs. That we have already trained. You have to put your feet on the floor. You have to put your eyes very comfortably on the eyepiece. Then your back should be straight. Yeah. Just give me a second. কেন বল তুই বল আমাকে কেন ওই সময় যাবি হুম, হ্যাঁ সেটা পারবি ওকে ওকে তাহলে কি আমি ডাকবো না তুই নিজে উঠে যাবি হ্যাঁ ঠিক আছে ঠিক আছে আমি ওই সময়টা ব্রেক দিয়ে দেবো চিন্তা so this one is not deleted, so then let me close this one. Oh dear, where do you go? So I just hit it. Unit 2 has run Unit 3, Kohler, CSML guidelines. So this is up to Unit 3. Okay, then Unit 4. Unit 4 accessing specimen integrity. Okay, let us do this one. Now a lot of things feels easy for you guys because you has already in the lab, you are doing it, right?
Yes.
Yes.
And I find a lot of the material is just repeat.
Yeah, a lot of materials are repeat. No, there will be some media and culture that is going to be new, but this is just a refresher. Okay,
Mhm.
so basically, you know why reason the blood culture are collected. Unexplained cause of fever. If you doesn't know why the fever is staying, how long is staying, so if there is any infection in the blood, that's why we do the blood culture. And then also whether you need any antibiotics or not, that is causing the illness. Whether it is a viral fever or is a bacterial fever, whether you need the antibiotics. To isolate the pathogenic virus causing septicemia. Sometimes you can do the culture to make sure is there any virus which is really causing septicemia, that is the blood poisoning. To check up parasitic infection of blood, if there is any parasite in the blood, whether malaria or anything or others. What is the reason that blood culture are collected? Again, the answer is to find the cause of an unexplained fever, right? Okay.
Yes,
What
ma'am.
is the anticoagulant in a culture bottle?
PS.
Number 3.
Yes.
PS.
Good answer. SAF is for the stool. You are going to read later. SAF is for the preservation of the stool.
Yeah.
Okay. Heparin, you know, it's still in the what type of tube?
Light green.
Light green, lot up. Okay. Okay, light green is what type of heparin?
Lithium.
And dark green?
Sodium.
Sodium heparin.
Mhm. Whole class, I can see 2 or 3 people's voice. All others are silent. That is not the, no, thank you. You guys taking the answer, giving this is called the active participation in the class. I cannot always point out, okay, you tell. We need the feedback from everyone. That is the participation. There is the marks on that. I give you the marks. That doesn't mean that you can do that. That means I cannot understand whether you know or not. It looks like I can hear the voice of suddenly Bharna, Kara, and Evelyn. Rarely I hear anyone's voice. It sense to me that you guys doesn't know the answer. They are telling, you are hearing, you can forget. If you tell, you will remember. If you made mistake, it's okay. Nobody is going to make you guilty. This is not the multiple choice that you are going to correct it and the exam is done. Here is the class for learning, for review. Okay, another review question. What is a concern with the underfilling of blood culture bottles? If you doesn't fill the culture bottle with the exact volume of blood when you are collecting the blood, except Evelyn, Kara, and Varna, anyone can answer?
Number 4, ma'am, can lead to false negative due to few
False.
organisms.
Organisms.
Okay.
Many
Yeah.
organisms.
Number 4.
Okay.
Yeah, number 4.
Okay.
It should
Too
be
few
many
organism. No,
Is it few or many?
few.
Few.
If you
Because the
have
blood will
less
be less.
volume, there may be less blood, means less volume in comparison, right? So number of organism will be less. So generally you have to put the minimum 10 ml of blood in each flask, each bottle. Minimum. If you can fill up to the line is fine. If not, sometimes if you cannot collect the full, what is that? The patient maybe have the infection, but it is going to give you the false negative result. Because the total volume of sample which is required to do the test is less. Is everything is clear to everyone?
Yes, miss.
Okay.
Yes, ma'am.
So can lead to a false negative due to few organisms. Okay. Like you collect the sample and you access in the laboratory for different types of samples. You have already known, you have known the principles, requirement, what is the safety, what is the acceptance or the rejection criteria. Now we are just reviewing specifically for the microbiology specimens in the lab. All specimens come to the lab through the accessioning department. So first you collect the samples at the phlebotomist, then you are sending to the receiving or accessioning lab. In the receiving system, they are receiving the samples, checking the samples, so the sample can be accepted or not, and then they are going to give a number. That is called the accession. That is called the receiving and accession department. They will give the accession. So from here, it goes to the different department, right? So in the receiving, they give the accession number. The samples has needs to the hematology, goes to the hematology, who is going to the transfusion, go to the transfusion, which is going to the histology, which is going to the chemistry, which is going to the microbiology. That's it. All specimen come into the lab to the accessioning department. Accessioning department stores specimen in the appropriate environment and awaits pick up by the microbiology department. It depends upon if it is in hospital or something, they automatically send to the microbiology department. If it is not, if it is collected in the center, collection center, so then you are sending to the lab. In the lab, they are deep the check everything, whether the again all the identification, all the criteria, every step they will check that one, and if the sample is everything is okay, starting from the patient identification to collection criteria to the volume, how it came to the lab, whether it's need any special cement with the ice, not ice, warm, 37-degree, whatever. If they come there, if it is okay, then they are going to give the accession number and they are going to keep it until it has been. They then inform the microbiology department and the microbiology will come and take. It depends upon lab to lab and organization, whether accessing department can send it directly to the microbiology lab to the tube system, or somebody from the microbiology has to come and pick it up. Often the microbiology departments prefers to accession their own specimen into the LIS. It depends upon the lab to lab. Sometimes if the microbiology lab specifically in hospital is everything is giving by the accession in specimen receiving and accession department. But sometimes microbiology, if they prefers, so their samples has been given a specific accession number for by themselves and they enter in the LIS system. Specimens are evaluated for integrity and appropriateness for testing. May have to troubleshoot if all information is not provided. They can reject it. So there are different things we are going to use for the collection of the microbiology samples. You can collect the urine, you can have the tube, you have the different swabs, you have for the stool, for the CSF, there are different types of collection tubes, which is mainly if it is the culture and sensitivity, it has to be sterile, non-sterile, depending upon what you are doing. Specimen integrity, label is attached correctly to the specimen. Require patient identifiers on label. Specimen source on label, what that means? When it is important?
To identify what specimen it is, because some of them look the same.
Right.
Yes, it's for the blood, yeah. Yeah, whether it's the blood or the urine or the undischarged or the pleural fluid.
CSF, yeah.
Okay, that is the
Yeah.
source of the label. Okay, from where you are collecting, source of the label. Date and time of collection on the label, delivered in a timely manner, collected in proper sterile container or media, correct sample collected for test requested. Enough specimen in collection container for test requested. Sometimes you have to have exactly whatever the needed, required. If it is less, it's very difficult to do, or maybe you can give the false negative results. Rejection criteria, we all know, poorly collected specimen may lead to failure to recover the pathogen, can result in the recovery of contaminating organism, can lead to incorrect or harmful treatment of patient, right? So, yes, either there is no bacteria or no things, or maybe the actual disease causing bacteria is not showing up as the sample is not collected properly, or doesn't have the appropriate volume. So when these specimens arrive quick communication to the ordering physician, ward, or physician's office is required before discarding them. So if you see the specimen like that wound discharge, CSF, pleural fluid, this is
Yes.
invasive. It's not easy to collect. So
No.
that time, if you feel that the sample is not acceptable for any of the reasons, what you are going to do, you have to call the physician or the physician office to inform. Then physician has to come, and if they want to give the sample, they have to do the waiver from certificate, and if they say no, we cannot use that, then you can discard. So these type of samples, you cannot discard it by yourself. Okay, but if it is a blood in the tube, that INR tube is not filled properly, or the lactate didn't came in the ice, or the BBG didn't came within 15 minutes, it's straightforward, you can reject it. As these are invasive and very difficult to get samples, so you have to, like the urine, if it is not properly, you can reject it, you can call the patient again. But the samples which are difficult to collect, you are not the person to take the decision whether you can discard it immediately without talking with the physician. All communication would be documented in the list system, the comment section of the specimen, so that nobody can tell you that you discarded it or you take the decision. You have to write, this is the sample when you receive, this is the sample 1, 2, 3, 4, jot down the notes, whatever you saw, whatever you think. Then I call the physician. If the physician come, whatever the physician tells or something, take the notes and laboratory information statement can be seen by everyone. If the doctors want to change anything, doctors will change it because everybody in the patient circle of care has the access. It may be necessary to process some specimens if they are irretrievable, invasive collection, difficult to repeat, refer to the microbiologist or MLT after talking with the doctor or keeping the notes. Clerical errors. Unlabeled, incorrectly labeled specimen, request the new specimen. No requisition. If there is a requisition, do not process until received. And not only the requisition, but no specimen, call collection site to see where sample is. Missing vial information, call ordering physician or collection site to ascertain missing information. Generally, to be honest with you, except the CSF or very invasive procedures like the pleural fluid or any the ascites or any you have to do the puncture. All samples are rejected. Especially if you doesn't have the patient identification number, identity name or anything, no label, nobody's until the doctor comes and say the waiver certificate. Received in liquid containers, non-sterile containers, do not accept for processing, notify physician. Specimen for anaerobic NO2, not received in appropriate container, notify physician. They may still want to process it, leave comment in LIS. Specimen received in fixative, the O, ova and parasite. So if it is non-fixative samples, it came, notify physician and ask for new specimen. That is the tool, they can give it to you. Delay in transit, prolonged transport if exceeds 2 hours post collection and not preserved, reject and notify physician. So this type of samples, invasive samples, it has to be go stat immediately. Transported at wrong temperature, reject and request new specimen. Inadequate specimen not in the sample spot tests, request call physician and ask for more samples to ask them to prioritize the test due to NSQ. So if there is a non-sufficient quantity, you are re-asking that sample to collection, but it's going to be delayed. So that time you have to tell is the NSQ, and that means it has to be work as stat or in the private basis. Inappropriate specimen, dry swab, notify physician and request proper specimen in the appropriate media. So if there are, you are going to see later, there are different transport media. So dry swabs, you put in the different, you collect the wrong swab It's not going to be accepted. Unpreserved urine held in fridge more than 24 hours, notify physician and request new specimen. You know, already learned it, is going to give you a lot of false results. Wrong collection site for test requested, call physician. So if they ask for the pleural fluid, somebody take the ascites from the abdomen. I'm just giving an example. That is the doctor's things. Scenario. For CSF, 4 CSF tubes came into the accessioning department and the patient labels are not on the tubes. Rather, the labels are on the outside of the pocket along with the requisition. What is the next procedural step?
Contact the doctor to make sure that he comes up and verifies that this in fact belongs to that patient.
Okay. Urine comes into the accessioning department and the collection time and data from 2 days ago and the specimen is at room temperature. What you are going to
Dis-
do?
Discard and reply.
the sample.
Good. One swab comes with the multiple tests include gum stain, culture, sensitivity, viral studies with AB. What is the next procedural step? Maybe you guys are not going to know that because it's not that. Only the include culture and sensitivity. You are going to later. The label attached to the swab has the spelling of the patient first name as Chris and the requisition has Christiana. All other demographics and specimen sources. What type and test my specimen is not leaking.
We had a question similar to that, I think.
I know. And they said you can accept it. If it is me, I'm not going to accept it.
I didn't accept it either. I
I
discarded.
don't accept it. And that is from
No,
the day one, it has been trained us that
that's right.
date of birth, first name, last name. But I
Yep.
saw in the D12, they told you can process and
They
make
did
a
us.
note.
They did
Yeah.
us dirty in the
Yeah.
D2L test.
Yeah.
Yeah, because
So,
For
we
that
I got
question.
that wrong when it's
Yeah.
Yes,
supposed
we
to be
did.
right.
no, I give you the marks. So that is the
Oh.
thing. I give you the marks. So
Oh,
because
okay.
and I wrote a note. So
My
if you
mark
say
didn't change.
you have to check, dear. I tried to give the marks. Yeah, which one? Yeah. So right, but whatever I wrote to them that is it is from it cannot be accepted. If it is the invasive sample, they didn't tell me whether it's invasive sample. If it is the invasive samples, I am going to wait. And there was no option
Yes.
whether we are going to go to the talk to the physician and others.
Yes.
If there is, we can do that.
Absolutely.
But sometimes I don't agree with the detail, so I don't know. If your unit if your unit 4 under accessioning specimen integrity and storage that is in your unit 4 under accessioning specimen integrity and storage, there is a specimen is a document for you to review. Okay. Reading course objectives, storing specimens in the laboratory. We have the refrigerator. Refrigeration will prevent overgrowth of other organism because it's the general temperature for except the fungi or mold. The normal bacteria or the microbiota always prefer the 37 degree or the temperature little bit higher because they live in the human body. They prefer the 37 degrees centigrade. It feels them cozy. Okay. So, but that's why if you keep the temperature below, they cannot grow properly. Their growth rate is very slow. Their growth rate is stopped. So the samples can be preserved exactly in their own condition as close as possible. This is good for urine, swab, feces, and sputum. Not for the blood culture. You are not going to keep the blood culture sample in the refrigerator. It is not effective for anaerobic organism, CSF, genital cultures like the gonorrhea. So whenever you are taking any anaerobic organisms, either in the culture, any type of culture, CSF is not going to stay. It's going to be stat. CSF stat. Plural field is stat. It's immediately go to the lab. So these specimens should be kept at room temperature until cultured. So immediate culture or freshly collected specimen is not always possible. If specimen processing for culture is delayed, refrigeration at 4 to 7 provides a specimen preservation until they can be cultured, but depend on the specimen type. As we learned before, the CSF cannot be kept there. Vaginal culture cannot be kept in refrigerator. It has to stay in the room temperature. Blood culture, it is not going to stay in the refrigerator, it's going to stay in the room temperature. Other samples like the urine, sputum, those type of things can be stayed there. Saliva. Exceptions are those samples that must be immediately cultured. What are those specimens that may contain gonococcal organism or certain meningitis caused bacteria in the CSF, or gonorrhea, it is in the vaginal or discharge. Laboratory personnel are responsible for knowing which organisms require immediate inoculation and which can be safely stored until processed for culture. We are going to learn what is inoculation means. You are going to take some samples and you are going to put in the culture. Make yourself familiar at your clinical site for specimen storage, retention, disposal requirements for microbiology laboratory specimen. Medico-legal specimen may increase time of retention. Think of those specimens collected with the chain of custody form. So these are the medical legal. When there is a chain of custody form is needed. Refers to the sample that is analyzed by lab as part of an investigative procedure from the police or foreign department, forensic department, the results of which may be presented as the evidence in the court of not law, lay law. My God. Okay. So ensure specimen and waste disposal. Ensure you know your clinical site specimen disposal requirement. How you have to dispose. Now you know in your lab, our lab, how you are going to dispose the biohazard, which one is going to be the shard, how you are going to do the, biohazard in the, what is called, cardboard box. That is one, the plastic big storage container where you put all the tubes, cartons, blood. So you guys know. So each lab has their specific rules and all are biohazard. So infectious material is required to be disposed of carefully, especially for yourself because you are working in the lab and also for the prevention of the spread of infection. And you are going to use the biohazard garbage protocols. All waste is put in biohazard garbage bags or buckets. Biohazard waste will be picked up on a regular schedule for the incineration by outside companies. So they are going to put it any biohazard. What is incineration? Anyone knows?
Burn,
Burning the waste.
destroying it.
Destroying the
Burning
waste
it.
by burning.
Burning,
Yeah,
high
burning.
temperature burning, high
Yeah.
temperature burning. Yeah. So they burn everything with very high heat so that anything, even the bacteria and spore and everything can be destroyed. So unit 4 is done. Oh, I thought it's going to be too difficult. It's going okay. What is this one? Not unit 4 is done. There is unit 4. So there are different things. This we have to, this is for you guys reading, but let me just tell you a little bit. Throat swabs. Throat swabs. In the lab, we used to take the throat swabs and teach them, but now it has been omitted because generally we are not allowed to take the throat swabs. So that's why we learn, but we doesn't do it. Before we used to do it. Throat swab, if rapid test and culture are required, collect 2 swabs. If only one swab is collected for both, set up the culture first. So, and not contaminated the swab before culture. If the rapid test is positive, culture is not necessary, like the COVID. Transport to lab within 2 hours in transport medium. Once plated to BAP, incubate for 18 to 24 hours at 35 degrees centigrade, 35 to 37 degrees centigrade. Swabs can be stored for 24 hours at room temperature. So they are not going, as we learned, they are not going in the refrigerator. So you can take them throat swabs, and there is a cultured media. So you can put that swab inside the cultured medium and keep it there for 24 hours before you do the inoculation or start the culture.
So,
So
Miss
if
Moon
there is
Moon,
a yes,
we do not do the throat swabs, right?
no, that I
Okay.
heard from Saina. Before you used to do that throat swabs, yes, and taking them throat swabs and then putting them in the saline or in the culture and doing that. Now we are not doing it now because that is rational is right that we are not allowed to take the throat swabs. Generally, either nurses or the doctors can do that. So, but when it comes to your accessioning department, you have to do all the criteria, check all the criteria for whether you are going to accept or reject it. If you see the throat swabs comes from the refrigerator, you are not going to accept it, but you are going to write the note in the and call the physician or the lab technologist. Urine, clean catch midstream urine, most common sample, right? The clean
Yes,
catch
ma'am.
midstream is a random sample or any special samples?
Midstream is used for the culture.
Yeah.
So
Usually
it's
mine's a
therapeutic.
random.
Culture and sensitivity test.
I didn't ask for the routine and the culture. I just ask you whether random sample or not.
It is
It
random.
could
Okay,
be
random
random.
sample.
Random. So that was a question. Random clean catch midstream urine is the most common sample, and some of you made mistakes. As you see the random, somebody make the marks in the fasting. Fasting doesn't mean fasting may be clean catch, may not be clean catch. Fasting urine, we just see different hormone, different concentration because that is the more concentrated sample. But for culture and sensitivity, you have to collect the clean catch midstream urine. What is called the clean catch means? Why is called the clean catch?
Because you disinfect the area and
And
then
then,
you,
yeah, then you are
Yes.
collecting the midstream of the
yes.
The
urine. That is
midstream
called the
opening area.
CCMSU. CCMSU. In short, it says CCMSU. Clean catch midstream urine. Okay.
Yeah.
So this is the random sample you can collect anytime, but you have to clean the area with the antiseptic wipe for the female front to back, for the another side of the opening of the urinary opening. For male, they have to pull the prepuce and then they have to clean from the center to periphery and hold the prepuce like that. It's not going to you're going to release it because it may again contaminate that. So you have to hold it and then you have to urinate it, catch the midstream, then you collect it, then you can release your prepuce. Okay. So catheterized specimens for those who cannot urinate. Who cannot? Who is the what is the absence of urine?
Anuria.
Anaria.
Anuria.
Anuria. Who cannot urine at all? They have to do the catheterize. So there are two types of catheter. One is Foley catheter and is a general catheter. What is the Foley catheter? What is the another name of the Foley catheter?
Don't know.
Nobody going to look at the Google.
What was the name, Miss?
Foley catheter. What's
Is it the
the
Foley,
another
suprapubic?
name?
Foley catheter or indwelling catheter. When there is a
Oh,
problem,
indwelling.
any person cannot pee at all. So
That time they put a catheter inside, which is stays in the body for few days or weeks. That is called the indwelling. The catheter which is staying inside the body is called the indwelling catheter. It is going straight to the urinary bladder, and blood fluid or the urine is coming and collecting in a bag. That is the indwelling catheter. And there is another way of collecting urine is called catheterization. So what they does, they put a catheter in the bladder who cannot pee, like the babies, some people, very elderly people, and they cannot pee or it's difficult to get the sterile urine from them. So that time they put the catheter directly inside the urine and the urine comes and they collect it in the sterile container. And that catheter does not stay. That is only for collection of urine. Clear the difference?
Yes, ma'am.
Okay.
Yes, ma'am.
Okay. So it said if collected from an indwelling folic catheter, collect from the tubing, not from the bag. So in the tube, there is a stopper with an extension. So you are going to collect it from there, not from the bag, because in the bag, urine is coming and depositing, is staying there. If there is anything, it's going to be bacteria or any, either it's going to be growth or there's a deterioration of the components. So because this is the storage of the catheter in the catheter bag where urine is storing. So you have to collect it from the tube directly. Urines may be collected during cytoscopic procedures using scope to view the bladder. When they are putting a scope inside the bladder, they can collect some urine. That is rare. Urine is not processed within 2 hours. Must be refrigerated 2 to 8 degrees centigrade, or you can use some preservative as per CLSI guidelines, especially when you use a preservative. When you have to add the preservative for the urine collection?
24-hour urine.
24 hours. 24 hours urine collection. Okay. If refrigeration is not possible, the most common chemical preservative for culture and sensitivity is buffered boric acid, which comes in tablet, powder, or lyophilized form. So, what is the mainly preservative agent is used is the boric acid. So, designed to maintain the specimen in a state equivalent to refrigeration by deterring growth, ensure proper specimen to preservative ratio by using fill lines or preservative tubes. It keeps the urine as close as possible as you refrigerate them, the preservative. If using the same disposable calibrated loop to include both BAP and MAC plates, this is the different name of the plates, inoculate and strike BAP first, non-selective media first. So this is we are going to learn later. This till now is not, we are not there, but they are overlapping. So general information, patient information, show some type of specimen for anything, whether it's a left knee, wound, synovial fluid, whether it is a pleural fluid, date and time of collection, initial of the collector, ordering physician, everything is in the requisition and you have to have the level. Antibiotics patient is taking if any. So you are till the doctors are telling to take the blood culture or the any wound, but the patient is on antibiotic. If there is nothing or the result which is comparing, if say per they did the for any wound or pleural fluid, when the patient came in the first day, they do the pleural fluid culture and they saw there is a huge infection. Then doctors started the antibiotics. It is getting till the patient symptoms are there, but whether the patient is getting better or the antibiotic is working or not. So doctors may reorder the culture and sensitivity test again. And from that, if they stain it and they can see Yes, these results is little bit better, or number of microorganisms or bacteria is less than the first time. That means antibiotic is working. It may be slow, but it's working. So that's why very important to make sure to write all the notes. Even the doctors has ordered the blood culture test or any culture test of any sample, whether patient is taking antibiotics or not. Delayed refrigeration at 4 to 6 degree is safe for most but not all specimen, as we learned that like the vaginal smear CSF. Refrigeration is particularly effective for feces, sputum, swabs from a variety of sources. Refrigeration is not effective for following, which set up immediately or if not possible, kept at room temperature until set up. They are susceptible to low temperature and anaerobes. So whatever not suitable for refrigeration, anaerobes, CSF fluids, genital cultures, gonorrhea, we already learned that. Not all pathogens are susceptible to drying out. For all microbiological specimens, follow the institutional policy and procedure. That is always, wherever you go, you have to see what is your organizational working policy. Just give me a second here. আমি শুনে যদি ব্রেক দেবো ওই জন্য জিজ্ঞেস করছে তুমি 11টা 10 ওরকম 11টা 15 মধ্যে ব্রেক হবে ঠিক আছে okay what is in the second page, let us see, this is done.
Miss?
Yes,
Can
break
I ask a
time.
question? Can I ask a question?
Yes, yes. That's a bit. What question? If Asnet says something,
Yeah,
means break time. Yeah.
sorry. Miss.
Oh my God. Take your
Miss.
time. Yes.
um, for the capital, when the patient have the bag on, right? So we know not to collect the urine from the bag. How do we collect it from from the tube?
There is a
Um,
outlet. Yes, a stop tube. Yeah, like
oh,
the valve open and close in the tube.
okay,
So
okay.
there is a tube and there is a valve. So you can open and close the valve. So when you are opening the valve, you can get it directly from your container. You are close the
Awesome.
valve, the O is out.
Okay, good. Thank you, Miss.
Okay. Good question.
Thanks.
Okay. So this is we already learned improper collection, definition of proper collection. SOP must be followed before antibiotics are started in general from the location where the pathogen is most likely to be found. In the wound, you are seeing the wound, but where you can see more pus formation and other things, you are going to pick up the sample from there with as little external contamination as possible. Improper labeling, specimen labeling must be an exact match to test requisition with source identified. Minor mismatch phone number can be followed up with the physician's office. That I agree. Okay, if the phone number doesn't match, but the all the date of birth, first name, last name, everything is because sometimes they change the phone number also, so they can check it up. Major mismatch name require rejection of specimen. See, in the different places they are telling different things. Never correct a specimen level that you did not collect or observe being collected. For invasive specimen or hard to recollect, to fix, contact the collector and request they come to the lab to the label the specimen or fix the label and ask them to sign a waiver taking responsibility for the error. Here in our hospital, if you made any mistake, whatever you say, they will not accept anything. I don't know the CSF and other things that they deal with the doctors, but for us, no, nothing. They are not going to accept. They are going to immediately reject the samples and you have to recollect it. Improper transport medium, improper storage, transport temperature, this all you know, leaking specimen, safety issue for specimen handling, contamination issue for specimen, wrong specimen provided. So it is written is the saliva, actually you are getting the urine. So labeling problem, wrong specimen has been sent. It has happened sometimes. When a specimen is rejected, the physician must be notified a new specimen request unless it's needed. Sometimes if the specimen is irretrievable like the CSF, that you have to talk, doctor has to come, identify the specimen, see the waiver certificate, whatever the required things as per the organization and the CSMLs you have to follow and do that. Examples, whatever I told. In examples are irretrievable specimens. Those are the invasive specimen, like the CSA, pleural fluid, peritoneal fluid, this pericardial fluid, any biopsy tissue, blood culture at the height of fever. Because at the height of fever means where it's a peak high, the patient is probably suffering for 7 days, but they are trying to get when there is a fever is less with the tunnel or other things, maybe they are not getting that much information. So this when the high temperature, you collect that one blood at that time. Oh, proper proper cleanup of a leaking specimen and other biological spill. CCSML's guidelines. Okay, so let us see what is next. And then we'll decide where we'll go. Here we'll stay in the stance. Smear and stain. I don't know how much stains they told you, so there are a lot of questions will be there. Come on. First of all, there will be gram stain. Microbiology, smear preparation, how to do the smear. Go for break. Take a good break, okay? And I'll work a little bit, and then I'll join.
Thank you,
I'm
miss.
sorry for the sorry for
It's okay.
taking a little bit time because we can complete one chapter, and then yes, and then probably we have some time to go through unit 5 and 6. I'll try to do some little bit. You guys take a little bit time and do little bit review of your things, and then I'll work a little bit with the Anderson, and then I will be back probably. And I will back. You guys take your break, half an hour or maybe 40 minutes, then come back, start your study, and I will join with you. Okay? Okay. Okay.
Okay, ma'am. Thanks.
Okay,
Okay.
miss.
Okay.
Thank you.
See you. Okay.
Hello, Miss Moon Moon. Hello, ma'am. Are you still there?
Sorry, miss, did you call my name?
তুই যেটা মানে কাজ থাকে হ্যাঁ, কি যদি মনে হয় কিন্তু হ্যাঁ, তুই যেটা যেটা তোর মনে হবে কাজ করলেই হলো তাই কাজ করছিস ডাজন্ট ম্যাটার তোর এখন লেখা রয়েছে
Christiana?
Hey, Asnet.
Hi, how are you?
I'm good. How are you?
Good, good. Do you know what time we're supposed to be back?
I think about now, right?
About now?
I think so.
Oh, Lord, okay. Not yet. Is it that time already?
Yeah, I think 30
Okay.
minutes is up.
30 minutes is up. Okay.
Yeah,
All right. Thank you.
no problem.
We're about 11:30. Like we have 45 minutes.
Oh,
Thank you,
thank you,
Evelyn. So we
Evelyn.
have another 10 minutes?
Yes. That's
Okay,
what mom
thank
said.
you.
Oh,
I'm
okay,
going
I
for
thought we are back.
I'm going for a 10 minutes walk. And then what you want
Okay.
us to what does she want us to do after she said?
Oh,
I want
nothing
you
in
guys to
particular.
play.
No play. No play. The time is too cramped right now. So.
Study.
Mom is so
I'm to be back with you guys. Study. I'm going to be back with you. Okay.
Okay, no
Yes,
problem.
ma'am.
Thank
Yeah.
you.
Thank
So
you.
10 minutes more. Okay, thanks.
Yeah.
10 minutes more. Yeah.
Okay, thanks. Thank you, Evelyn.
Guys, we miss Unit 3, right? Have you noticed that?
No,
What,
Or
because
you're
she
Aparna?
not?
said that we already cover it, so that's
Oh,
why.
the units. Oh, I see.
Yeah,
Okay. Because I'm
yeah,
checking the D2L. Yeah. Okay. Thank
yeah.
you.
I mean, you can always review it like
Yeah.
on your own, but because she already covered that topic, it's almost like a repeat. That's what
Oh, I
she's
see.
okay.
Okay.
There,
Thank you. Yeah.
you're welcome.
Good. Delete. Mm, mm. Oh no. Okay, so us. Okay, good. Dollar. Stage. This one. Bacteria. Triple immersive pathogen for what? What? Oh. Borrow. What? Oh dear. Mm, 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 mm. ওইটাই করেছিলাম। Pathogen. CDE. A B C D E B C D E A B C D E. Okay. Good. Radial and Paro. এখানে তো নামলো। Sorry. Bold. Bold.
Hold. 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 Let me see. Complete this one first. Estrogen. T. DRCT. Intestinal tract. C. Also this one. Okay. Mm. Shape. Okay. Round in shape. Shape. Pears. Pears. Staphylococcus. This is done. ETI. ETI. E SPORE. 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 FORM. Former. Spore former. So E so 000 X low over objective. Okay.
Good job. Yeah. Close. Save. Done. Close. What is that one? This. Okay, so this one. We close. Micro. So copy link. Then go here. What? I have to close everything? Mm. Mm. Mhm. Mm. Mhm. 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 Okay. Have to do this one. Okay. Tested also
Thank you, Miss Mumun. I just seen your test your knowledge.
Yes,
okay.
thank you, ma'am.
Yes, thank you.
And for the notes, thank you also.
Yeah.
Okay. Notes is not only for this test. It's a lot of information for including unit 1 to 7. Okay.
Yes, we got both email.
Yeah.
Thank you.
Thank you.
Okay. Okay.
Yes, ma'am. Thank you for that
Thank you,
early
ma'am.
Thank
review.
you, Miss.
Thank you. Appreciate it.
Okay. Ashley went to work and I worked on the review, the
Okay.
Okay,
studies.
ma'am. Thank you.
Appreciate it.
Okay, okay, okay. So let us go back where we are now. Okay. Where we are teaching. Let me see how much is we need to be taught. So go to the inbox. Everything has been vanished from here. Thank you, Benas. Thank you for immediate response. Thank you. Yes, yes, let's in new detail. Uh, so this one, oh my God. Okay, let me go. Oh dear. It is professionalism, hematology, clinical micro. Examining specimen to cover the program stands. This is in unit 6. Unit 6. 6. Culture sample 6. 7. Okay, let us go to unit number 4. Accessing this button is done. Okay. Am I on video sharing the screen? Mic is on. Share. Share. Okay. So you know about so far that's the microbiology. Microbiology is a small animal, not animal. It's a small microorganism which cannot be seen by the naked eye, due to microscope. But how we are going to see it? Can we see in the naked eye? Even how we are going to detect it? So that's why you need to color them. That is called the staining. For doing the staining, you have to do some procedure. They have to capture them in some places, then you can stain them. So how, okay, let me this. So this is the course objective is describe the morphology and characteristics of gram-negative and gram-positive bacteria. Now you have know the bacteria, but bacteria you have the classified as per their shape, size, and outside morphology. Now you have to see what is the difference between two types of bacteria as per the basis of the structure, biochemical structure. So gram positive and gram negative. Just give me a second. So we are going to discuss what is the difference between the gram positive and gram negative. Okay, so okay, let's complete query. Okay. 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 So then when you know how we are going to know which type of bacteria as per shape or size or depending of the membrane biochemical membrane structure. So that's why you need the stain. Generally we stain the bacteria name called gram stain. So we are going to discuss how to make a spear, how to do the gram stain QC and expected results. And additional stains also we can discuss what is can be done for the bacteria like the acid phase stains, fluorescent stains. Okay, so direct smear. Direct smear means is direct. From the sample you are going to do a smear on the slide. That is called the direct smear. So a direct smear is made from the collected specimen. You just collect a specimen exactly, no culture, nothing, no growth. Whatever you have collected, you are going to see by making a smear. So how you make it is a thin layer of specimen placed on a slide for staining. You can roll with a cotton swab. You can put a drop of the suspended sorry, solution or any wound discharge or anything, whatever. You can put a drop on there, or if it is saliva throat swab like that, you can make a spear rolling the throat swab or swab sticks like the cotton swab on the slide, and then you are going to dry it and then you are going to do the staining. So it's a thin layer of specimen placed on a slide for staining. What it does, judge the quality of the specimen, provide the physician with same day, some preliminary identification so that patient is really, really sick. With the same thing with the gram stain, physician can say, oh, is gram positive bacteria or gram negative bacteria or presence of bacteria or absence of bacteria. Because culture and sensitivity results takes 48 hours to come, because you have to culture them, grow them, then you have to do the staining, smearing and staining. So immediately from the same sample, from the direct sample, you can make a smear, you can stain it, which can give you some idea whether the condition of the patient. Contribute to selection of culture media if mixed flora. If you can see there is a mixture of not only one type or two type of bacteria, there are different types of bacteria. So then from there, you can also decide what type of culture media. Culture means from there, from the direct sample, they are going to culture to make it more bacteria of the same time to make sure what type of infection is there. So if there is a mixed culture, mixed type of bacteria there. So which culture media is going to be the best for develop this type of bacteria or the mixture of bacteria, or how we are going to culture them with different media to see what type of bacteria is there. So that give you the basic information. Provide an internal QC when direct smears are compared to culture results. So you have the basic result from the direct sample. Now if the culture and sensitivity doesn't come anything, it comes negative. That means there may be some problem somewhere. Here is the QC. So you have, that is the direct. So that should be the original result, because you take the sample immediately and you stain it. It's giving you some indication there is some presence of bacteria. What type of bacteria, maybe you cannot get it. You can get it with the shape or size or nothing, but what type of antibiotics or something, or you may not get it, but you can understand there is a bacteria. Now in the culture, after doing the culture, they doesn't see any bacteria. So that means there is some problem during the culture. Smear preparation. How to prepare a direct smear? If the material to be examined is delivered in a swab, the swab is used to spread on the slide. Cotton swab like that. Sometimes they take the, whenever you did the throat swab or eye swab or anything you saw, they took in like a cotton bud type. So they took that one and then they put it in the culture medium, or you can directly collect the swab from your saliva or any wound places or in throat or tonsil, and you can roll that swab on the slide to spread the bacteria or the sample on the slide. And then if the material to be examined is a liquid such as a broth culture, it may be transferred using a sterile swab pipette. So if you are taking from the urine something, say for example for the culture to see, it's a liquid. If it's a CSF, it's a pleural fluid, any wound discharge where there is a liquid, you cannot roll with the swab. So where I told you what you have to do, how you did the microscopic examination, same thing. So for any liquid which needs to be tested for any bacteria, so you are going to mix it and then take one drop on the slide. If the sample is an isolated colony taken from an agar plate, a drop of sterile water may be used to suspend. So even you can do the staining. So after doing the culture in the agar plate, you can see some colonies. You are going to see the colony means the group of bacteria is developed there from a colony, bacterial colony. So even sometimes for doing the staining there, so you can take one colony, but it's going to be too thick to spread. So that's why you have to little bit suspend it in a saline or distilled water. Then you shake it, mix it, and then you can take a drop and spread it over the slide. Swab. Sometimes specimens are sent to the microbiology in a two swab system, one for culture and other for gram stain. So when the doctors order culture and sensitivity, so sometimes they take two swabs, one directly so that they can do the culture and sensitivity so that there will be no contamination, and another tube for doing the instant gram staining. to see whether there is a presence of any bacteria, whether it is a gram negative or gram positive. In case they said only one swab tube and 2 tests has been ordered, gram staining and the culture and sensitivity. Which one you are going to do first?
Culture.
Culture and sensitivity, so that there will be no chance of contamination. So you are going to inoculate the start doing the procedure so that the bacteria can grow, and then you can use that swab to do the gram stain, putting the smear. If the specimen is submitted to microbiology on a single swab, however, the culture media must be inoculated first and then the swab rolled into the surface of the dry, clean glass slide. Slides may not be sterile and thus are prepared last after all other culture media are inoculated. If you have to develop in one media, 2 media, 3 media, or whatever you do this one, then you are going to work on the slide, because glass slide is non-sterile. Once you touch that one, you can do the culture because there will be contamination. This may differ at the side you are working. So smear preparation with swab. This is the swab. You are going to roll it. If it is liquid, you are going to take a liquid and then you are going to spread it, and then you are going to spread it with the evenly with the loop is called the loop, and then you are going to cover slip it. So smear preparation, all direct smears must be labeled with sufficient patient identification information. It is sometimes helpful to draw a circle using a wax pencil on the underside of the slide directly under the area where the specimen has been placed, so the examination area may be found more easily. Why they are telling this one? You looks this one little bit frosty, but sometimes, like the CSF, is so clear. You put one drop, you dry it, you put the slide, then you cannot understand exactly where the sample is. So maybe you have to scan the whole slide. That's why telling from on the back side, on the top, you cannot do that. Once you place a sample, you can make a circle or it is a designation mark where your samples can be. Then you can do whatever the staining or direct, and then you can observe under microscope just looking at the specific area. So no, okay, so in this area, if I get anything, I will get in this area. Fixing. Now you have the smear, whether it's a liquid, direct, whatever maybe, but it's in the slide, it's moving. For that, you have to fix it. How we are going to fix it? So allow the slide to air dry. That is the best one. To allow the slide to air dry. Do not use heat to dry. Normal dry. After the material has air dried completely, it must be fixed to the slide. Once it has been air dried, that means it's called the air dry, means when it's done, it's going to be fixed on the slide. Fixing the slide helps to secure the specimen to the slide to ensure it does not lift up during the staining process. So you are putting it, you are drying it so that all the staining material has been tightly adhered to the slide and it's not going to come out during the vigorous staining process. So that is called the fixing of the slide. So then fixing the slide helps to secure the specimen to the slide to ensure it does not lift up during the staining process. Then you can fix the slide using methanol. That is going to be give more strength in the fixation for 1 minute. Heat fixing should not be used as it can result in distortion of the cell shape and may result in a misinterpretation of the result. Because when you are doing the heat fixing, the cells or the bacterial cell wall or the structure can be distorted. So you cannot understand exactly the shape or the size or the morphology. So gram stain, that is the most common stain for the general routinely used stain. Several staining procedures are used in the microbiology laboratory, but the gram stain is used routinely and yields valuable information. Gram stains are also used to examination of cultures to determine purity and preliminary identification of bacterial microorganisms, which I already discussed before. Gram stain results on specimens such as CSF, sputum, cultures can be of great value regarding preliminary information that allows the physician to begin treatment of patient. CSF, if the patient has a meningitis, for the culture results is going to take 48 hours, but the patient needs the treatment immediately. Any wood culture is getting worse, is getting spreading up, so it has to stop. If there is a gram stain, that is the result is positive, presence of bacteria, doctor can start the antibiotics. Later, with the more culture, more sensitivity and other things, you can do more specific antibiotic testings and other things. But with this one, at least you can start with the broad spectrum antibiotics to treat the patient. Types of stain. We have simple stain, we have differential stain. Simple stain procedures employing crystal violet, fuchsin, methylene blue, saffron have limited use in the microbiology laboratory. These are termed simple stain because a single chemical stain is used and all structure patients are stained one color. When a simple stain is used, organism should be observed for size, shape, cellular arrangement and uniformity of staining. So it can tell you the size, how long it is or short it is, shape, whether it's a cochlear, diplococci, is a spirochete, or it's a, what is called bacillus, corynebacterium. So, and the cellular arrangement, that means whether it is gram positive or negative, and can uniformity in staining, whether the stain has stained uniformly. In one area is more uniform, another is not uniform. So, the distribution. Differential stain are used to distinguish types of bacteria based on the biochemical composition. The most frequently used different stain is gram stain to tell the biochemical composition. That means it's going to tell you the cell wall structure. Gram stains, also Crumbram's method, is a method of staining used to distinguish and classify bacterial species into two large groups, gram positive and gram negative. This is the name came from the Danish bacteriologist Hans Christian Gram, who had developed these techniques. Gram stain purpose to give a preliminary identification of bacteria. What type of bacteria? Gram stain is almost always the first step in the preliminary identification of bacterial organism. Is getting repeating, is telling is a preliminary and is a good quality control, quality assurance or quality control stain. While gram staining is a valuable diagnostic tool in both clinical and research setting, not all bacteria can be definitely classified by these techniques. So, majority of the bacteria can be stained with the gram stain, but there is still some bacteria which cannot be stained with the definitive. Those are called the gram variable or gram intermediate groups. Okay, how does the gram stain differentiate? Gram stain differentiate the bacteria by the chemical and physical properties of the cell walls, detecting the peptidoglycan. I told you before, yesterday or Monday when I was teaching with peptid come from the protein, and protein is combined with the sugar glycan. So it's called the peptidoglycan layer, which is in present larger quantities in the cell wall of gram-positive bacteria. So there is a little bit in the gram-negative, but it's in the major position. It's more in gram-positive bacteria. So peptidoglycan layer is present in gram-positive bacteria. While the gram-negative bacteria also possess that layer, but in a very rare quantity or very small quantity. So what happens? If it is very small, then it dissolves when alcohol is added. And that way, this peptidoglycan layer actually catch the color of the cell membrane from the gram positive one. But the gram negative one, this peptidoglycan layer is so weak, so thin. So whenever you put the alcohol as a final rinse during the staining process, it's washed away. So what are the gram stain steps? These steps is very important. It's going to come in different way. What are the different steps for the gram stain? You have to, in your exam, you have to write the steps also in the final exam. There will be gram staining. Okay, so gram staining ingredients. First one is the crystal violet. That is the primary stain, because we told you we use the gram stain is a differential stains. It can stain the cell membrane and the cytoplasm with the different colors. That is called the differential stain. So crystal violet is the primary stain. This is the basic stain. Then we have the iodine. It's modern. What it does, it helps in the bridging the dyes or the stain with the cell structure or cell membrane. So it's the iodine. It's called the mordant. Then we are using the acetone and 95% ethanol, 100% acetone and 95% ethanol. This is called the decolorizer, because when you are putting in the dye, it's going to be like ghost. It's black, dark purple. Then you are going through that, but you have to decolorize it. Only the cells, not the total slide we need staining. Only we need the stain, the slide where the bacteria, suspected bacteria is there. So, and the next one is the second stain or counter stain is the saffron. It's a red color stain. And then we are going to wash it with distilled water. So make direct smear allowed to air dry, fix smear with methanol at crystal violet. Remove 1 minute. Here all the steps are 1 minute except the decolorization. I'm going to tell you it has to be mainly the eye estimation. It says 10 seconds. Sometimes it may be when the stain is fresh. Sometimes it may take less amount of time. So you put the slide in the crystal violet for 1 minute. Take the slide out. Then we are going to wash it with distilled water for 2-3 times. And then you are going to drop it again, put the slide in the iodine, which is a mordant. And after keeping it for 1 minute there, you are going to again take out that slide and wash it again. Then after that, you are going to decolorize with alcohol and 95% methanol and acetone. It is says 10 seconds, but you have to dip the slide and see how much stain has gone. If it is too much, it can totally make you clear. So you have to see the how much, how long you can decolorize. And then after decolorization, you can put them in the water for the rinse. Then you are going to add saffron and then remove the excess stain with the distilled water, then allow to wet dry, and your slide is ready to see under the microscope. So here is the gram stain procedure. See gram stain, crystal violet, it is taking the stain on the peptidoglycan layer, that is the outer layer. You are putting the crystal violet, in between there is a wash, putting the iodine mordant, wash, decolorizer, wash, then the saffron. What is coming? Is getting, this is the gram-positive bacteria, bind with the dye, bind with the mordant, then you are going to wash it in the alcohol or water, and then it's going to put the saffron, and ultimate outcome is dark purple because they have the peptidoglycan layer. But same procedure we are going to do if the gram-negative bacteria, they doesn't have the good peptidoglycan layer. So this color dye cannot stay there. Their bacterial wall, they cannot bridge or can form the color dark purple. So what is going to ultimately happen is going to stain. You are going to put the stains. Then when you do the wash, everything will go out. What the stain will remain? Only the saffron is going to stay. Here, you can say we are putting two stains. Why you are going to see one stain? It's not true. You are not seeing only one stain. This is showing that in big, higher magnification, you can see the what is the stain inside your soiling or anything. Okay. So gram-positive bacteria retain the crystal violet stain, what I told you, due to the presence of peptidoglycan layer, and thus are stained violet. Gram-negative bacteria do not, because after washing, the crystal violet goes away. So only the counter stain, which is the saffron, can stay. So gram-negative bacteria do not. After washing, a counter stain is added, commonly saffron or fusin, that will stain this gram-negative bacteria a pink color. Both gram-positive bacteria and gram-negative bacteria pick up the counter stain because they have the basic cell structure, right? Both of them picking up the pink, but only the positive one is going to show or is going to come looks the deep purple. So they picks up the counter stain. The counter stain, however, is unseen on gram-positive bacteria because of the darker crystal violet stain. When you are going to see it in the oil emulsion, you can see the inside the bacterial cell is a little bit light reddish color, but mainly it's going to take the black color, sorry, crystal violet color. So basic of gram stain reaction based on amount of peptidoglycan found in the cell wall. Gram-positive bacteria have many layers which contain what is the acid it contains. It's called the teichoic acid. It doesn't come in the question very rarely. So what is in the main thing in the peptidoglycan layers is the teichoic acid. This is the teichoic acid. And then this is the protein, this is the lipid, and this is the main thing. Teichoic acid helps to bind the dye to the membrane. So teichoic acid reacts with crystal violet and the iodine to make a large crystal violet iodine teichoic acid complex which resists decoloration. And gram-negative bacteria have only one layer of peptidoglycan with no teichoic acid. They doesn't have the teichoic acid, so they cannot pick up the dye also. Yep, okay. In addition, gram-negative bacteria has a lipopolysaccharide outer layer which is readily dissolved by the decolorizer. You don't have to remember that one, but only just remember the gram-positive bacteria has the peptidoglycan layer which contains and keeps the crystal violet stain. Whereas the gram-negative bacteria, they doesn't have the what is called? Anyway, the gram-positive bacteria, so they are taking the peptidoglycan layer, they are taking the gram-positive crystal violet stain, and gram-negative bacteria, they cannot keep the stain. We are staining it, but they cannot keep the stain because they doesn't have that thick peptidoglycan layer. So it becomes washed away when you do the wash with the acetone and it's the decolorizer. What is acetone and 95% methyl. Counter stain is the saffron, that is the pinkish red. That is called the counter stain or second stain to make sure. But the counter stain, the saffron stain is taking back both of them equally. So the gram-positive cells, you can see more darker crystal violet stain and less inside the saffron or the counter stain. What is the gram-negative bacteria? You are going to see mainly the pinkish or saffron stain.
Say hello to the first ready-to-use AI-powered EQMS. Our intuitive user interface enables companies to seamlessly enhance quality processes, cut costs.
The Gram stain is named after its inventor, Hans Christian Gram. As a Danish botanist and teacher of pharmacology, he devised this important method of differentiating bacteria in 1884 that is still in common usage today. The Gram stain is used to distinguish between gram-positive and gram-negative cells. It is the most commonly used method to observe bacteria. The Gram stain provides two important features: the Gram reaction, or color of the cell, and the cell morphology, the shape of the cell. Bacterial cells can be spherical, rod, or corkscrew in shape, and nearly all clinically significant bacteria can be differentiated into these three groups. Knowing which type is causing an infection is critical to patient care. The Gram stain differentiates cells based upon differences in the structure of the cell wall. The cell wall is made up of peptidoglycan, which consists of sugars and amino acids that form a layer around the plasma membrane of most bacteria. Bacteria that stain dark blue-purple are called gram-positive. They have a thick peptidoglycan layer that retains the primary dye. Conversely, bacteria that stain pink to red are called gram-negative. They have a thin peptidoglycan layer that loses the primary dye when flooded with alcohol. The Gram stain begins by adding 1 drop of sterile saline or deionized water onto the center of the slide. Then take a sterile loop and touch the edge of an isolated colony on the Petri plate. Place the loop into the drop on the slide and swirl it around to distribute the cells evenly, so the cells are 1 layer thick. Using cells from a single colony is important, as this should represent only one cell type rather than a mixture of cells. Ideally, the culture should be between 18 and 24 hours old, because older cells may show variable results. Alternatively, you can use a collection swab from a clinical specimen or environmental sample. Do not heat the slide. Wait for the sample to air dry. Bacterial cells are then fixed to the slide using methanol. Fixing cells is important, as it prevents the cells from washing off during the staining process. Methanol fixation is recommended rather than heat fixation, as methanol preserves the cell's morphology. Heating the slide will cause cell distortion, could increase cell debris, and may cause erroneous Gram reactions. Place or hold the slide over a paper towel, and flood the slide with absolute methanol for 2 minutes. Alternatively, you may dip the slide into a Copeland jar filled with methanol. Once 2 minutes have passed, tilt the slide and drain off the excess methanol and let the slide air dry. Do not wipe or blot the slide, as this can remove cells. Do not heat the slide. Cover the slide with the primary stain, crystal violet, for 1 minute. Crystal violet is a dark blue to purple dye that stains all cells. Rinse the slide with deionized or tap water to remove excess crystal violet. Flood the slide with Graham's iodine for 1 minute. The negatively charged iodine molecules act as a mordant and link to the positively charged crystal violet. This traps the crystal violet in the peptidoglycan layer. Once 1 minute is up, rinse off the Graham's iodine with deionized or tap water. Tilt the slide at an angle over the sink or tray and add the decolorizer dropwise until the violet color stops running. When the solution runs clear, immediately rinse the slide with deionized or tap water to neutralize the decolorizer. The decolorizer is composed of a ratio of alcohol to acetone. The ratio is normally a personal preference, with faster decolorizers containing higher concentrations of acetone and slower ones containing higher concentrations of alcohol. When decolorizer is added to the smear, lipids are extracted from the cell wall of gram-negative bacteria. Lipid extraction causes an increase in cell wall permeability, and the cell becomes leaky, resulting in the loss of the purple dye mordant complex from the thin peptidoglycan layer. In contrast, the effect of decolorizer on gram-positive bacteria is dehydration. This decreases the cell wall permeability, causing gram-positive cells to retain the crystal violet Graham's iodine complex. Note that a thick smear will require more decolorization than a thin smear. Be sure to stop the decolorization process immediately after the blue dye stops running off the slide. Beware, over-decolorization can result in false gram-negative results. Beware, under-decolorization can result in false gram-positive results. In essence, gram-positive cells will be blue-purple, and gram-negative cells will be colorless after decolorization. The final step utilizes a counterstain of a different color to differentiate gram-negative from gram-positive cells. Cover the slide with safranin or carbolfuchsin for 1 minute. The gram-negative bacteria will absorb this dye, causing them to stain pink to red. There will be no effect to the gram-positive cells since they retain the initial crystal violet stain. Rinse the slide with deionized or tap water. Do not wash the slide excessively. Allow the slide to air dry by tilting it onto a paper towel or over a sink and allowing it to air dry. Alternatively, gently dry the slide by blotting it using a lint-free bibulous paper. Do not use a wiping motion, for this can remove the smear. To summarize, crystal violet exposure, 30 to 60 seconds. Iodine exposure, 30 to 60 seconds. Acetone alcohol decolorizer, only enough time to rinse away the blue stain. Safranin exposure, 30 to 60 seconds. The slide can now be viewed under the microscope. First, focus on the image using the high dry objective lens marked 40x. Then, without removing the slide, switch to the high power oil immersion objective lens that is marked 100x. This will result in an overall magnification of 1000x. Here you see two organisms routinely used for quality inspection at Hardy Diagnostics. The purple gram-positive cocci are Staph aureus. The pink gram-negative rods are E. coli. Hardy Diagnostics offers an improved formulation of gram stain called Gram Stain Advanced. This kit produces superior stain results with bright, vivid colors, even for bacteria that are difficult to stain. To test the quality of your stain and staining technique, Hardy Diagnostics offers quality control slides, the Q-Slide Gram, that are pre-inoculated and methanol fixed with gram-negative and positive bacteria. Thank you for watching this gram stain demonstration. Hardy Diagnostics is your complete one-stop shop for all your microbiology supplies. Give us a call and experience our culture of service.
So if they question you, saprin, pinks, gram positive and gram negative cells. Yes, gram positive and gram negative bacteria. True or false?
What? What did you say?
Saffron or the counter stain?
Yes, ma'am.
Hmm?
It stains gram negative red.
This saffron or counter stains, whether it stains gram positive and gram negative stains,
False.
gram positive and gram negative bacteria. Counter stain saffron stains gram positive and gram negative
Okay,
bacteria.
that's
True,
false.
true
It's
or
false,
false?
ma'am.
False,
False.
because it's only gram negative
False.
that it stains.
Only gram negative.
No.
It has no effect on gram positive.
That's different. It stains the both cytoplasm. Gram positive. It is true. It stains both the cells, but the gram positive one has a thick peptidoglycan layer which captures the more crystal violet stain. That's why you cannot see it.
Okay.
You cannot
It
show.
stains- Oh, okay. The darker stain will overpower the pink stain. Yeah.
Yeah, but the crystal violet stains, can it stain both gram positive and negative?
It can't stain gram negative.
Only gram
Because it
positive.
doesn't have the pigment to retain the color.
Crystal violet, Amina, listen the question. Crystal violet.
It can't
It can
stain gram negative.
False.
It will not retain the gram. The gram
exact.
negative will not
Okay.
retain the color.
Okay.
It
But
can't
if
stain
the
gram negative.
yeah,
It won't retain.
it is cannot retain after your stain. Okay. So as there is no peptidoglycan layer, so ultimately you cannot see the stain.
Doesn't have any effect.
It is not, you cannot see the stain, crystal violet stain in the gram negative, but in the gram positive, you can see that one. Okay, the first stain is called the crystal violet. Counter stain name is saffron. Okay, that is the red color. Okay, so basic dye is crystal violet and the counter stain is the saffron. We did see this one. Gram stain review. How we are doing that? We did the same thing. Crystal violet. Then you are going to do the wash. It's going to taking the stain. Then you are putting the grams iodine. That is the, what is the role of the grams iodine? What is called?
Mordant.
Mordant. What it does?
Like it enhances, I think, ma'am, the cell wall of the
It helps
cell
to
wall.
bridge the dye to the
Yeah.
peptidoglycan layer. So binding of the dye can become more strengthened. Okay, that's
Okay.
called the mordant. Then you are going to decolorize with acetone and ethanol, right?
Yes,
And
ma'am.
then after that, you are going to put the counter stain. You can do the saprin or methylate. It can give you both. So in a population, if you see both of the color, what do you think? What type of bacteria is there?
Gram positive and negative?
Yes, both type,
Mixed.
both gram positive and negative. So gram stain results. How the gram stains looks like this type of color, or gram positive looks like this type of color. If you go to the higher resolution on this bacteria, you can see inside there is a little bit pinkish or reddish color. But it takes so much crystal violet, retain so much crystal violet color, so it looks more violet or purple, and this looks like pinkish. It's little bit reddish, pinkish reddish. Okay, gram negative.
And then after that, is that when they culture things and they differentiate between what exactly is in there, like what infection or what
What type
bacteria?
of gram-positive bacteria may be different, 50 times
Yeah.
gram-positive bacteria.
Yeah.
Okay, so they can
Okay.
be killed by the broad-spectrum antibiotic, but somehow it's
Yes.
not working. So then they have to do the culture and
Culture.
sensitivity, which specific bacteria is there. That
Yes.
is, they're going to the culture in the agar plate and then making the colonies, individual colonies, and then they are going to see use the different antibiotics to see which antibiotics is specifically working for the specific bacteria.
Will they automatically run the culture and sensitivity testing, or will they wait to see if the treatment is not working? Then they'll run it and see which specific treatment.
Generally, whenever if they say the gram-positive bacteria in the
Yeah.
gram stain, doctor started the antibiotics.
Yes.
It's called the broad-spectrum antibiotics, which is
Right.
can kill overall all types of bacteria.
Right. Okay.
But sometimes
Yeah.
some specific bacteria
Doesn't
is
react.
not is acting slow. Is that medicine dose is not in the broad spectrum antibiotic. That is different types of antibiotics is there. It is not
Yes.
specific. So, but that type for that specific bacteria, maybe that concentration in the antibiotics is not enough to kill that specific bacteria.
More
So
stronger.
then you need the specific antibiotic, whether it is the amoxicillin or is the coxacillin,
Yes.
the erythromycin. So that is or the combination. So that's why you need the culture and sensitivity.
Okay.
Antibiotic sorry. Antibiotic sensitivity. Which antibiotics is more sensitive? Which antibiotic the bacteria is getting killed?
Yes. Yeah.
Generally, doctors start with the amoxicillin. One is the broad spectrum antibiotic.
Yes.
Then, if doesn't work, they go cultural sensitivity or more specific higher strength. And ultimately, if it is still continuing after 5 days, 6 days, then they have to do the culture and sensitivity.
Right.
See the results for the active antibiotic. Okay. So where we are. So QC gram stain slide, what they're telling, these are done at the start of a new shift or timed, done to assure staining process is accurate. QC. QC slides are both E. coli and Staphylococcus bacteria mixed and air dried. Stained before or alongside patient slides. That is for the QC. This is the E. coli and Staphylococcus. They knows which one is which bacteria, right? To make sure the stain is working or not. So that's why stain before or alongside the patient slides, depending on clinical side. Expected results, E. coli gram negative, which is going to give you the pink color. So in a mixture of, they have the E. coli and Staphylococcus, both. And they put it in the slide and they do the QC run to make sure whether their stain is working or not. Otherwise, how you are going to see if your QC test is not done and if your patient sample, there is no staining of any bacteria, you cannot understand whether it is really present or absent. So you have to have a QC. You guys know that now. So this is the QC slide. Then you are going to run the patient slide side by side to make sure if there is any bacteria, if bacteria, what type of bacteria, gram positive or gram negative, and also here later, now they didn't show you here, you can understand whether is a diplococci, is a spirochete, is a what is called staphylococcus, or is a chain in cluster, it's rod shaped, you can understand that. This is very 10x or 40x slides. When you go to the 100x oil immersion, you can see that. So, but here you can see to make sure the stain is working, they do the QC positive control, use the E. coli as a gram negative bacteria and Staphylococcus as gram positive bacteria. Okay, so it's clear. These are the, which one is the E. coli here?
The pink.
Pink one.
Pink one.
Pink one. Yeah, and dark violet one is the Staphylococcus. Everybody agrees? What
Yes.
is Staphylococcus? Positive or negative?
Positive.
Positive.
Okay, good. C. The Neisseria gonorrhea. You can see there are two types of dark stain and light stain. Pneumonia in sputum. So how they do the color? This is more roundish. You can see these are diplococci type. You can understand. This is pair. Some are in the pair. Diplococci. Some are cocci. One single, but majority of the diplococci you can see. You can understand this is in pair.
Yes, ma'am.
Okay, good. So gives more example how it looks like. So it's a different bacteria how it stains looks that. E. coli, gram negative. This is titanitoxin. It says mix. So this is more darker violet, lactobacillus, fusobacterium. These are called the gram variable bacteria. Some of the cells retain the crystal violet and some display the color of the constituent saprophyte. So not all. So see, half of the cells sometimes taking the crystal violet, that is called the gram stain variable. What type of bacteria? Let us see. So there are 4 possible factors for gram stain variable: genetics. Some bacteria will allow variable amounts of teichoic acid to build up in the cell wall. And this the teichoic acid is the main factor which retains the stain. So how much teichoic acid, whether evenly distributed in the cell membrane of that bacteria, it matters. If it is not evenly distributed, it's built up in one place, in the another place, that is a less amount of teichoic acid. So what is going to happen? Some portion is going to keep the crystal violet stain and some portion is not going to keep it, so it's going to pinkish. So it is neither gram positive nor gram negative. That's why it's called the gram stain variable. Age of culture, gram stain should be done on fresh 18 to 24 hours old cultures. Older cultures develop variable amounts of teichoic acid, giving the false results. Type of growth media. Some types of media do not have the nutrients necessary for normal cell wall development. Bad technique. Smear is too thin or uneven or it's not stained correctly. So we are going to start from acid fat stain tomorrow, okay?
Yes, ma'am. Thank you.
Yes,
Okay.
ma'am.
Okay.
Thank you.
Because gram stain, we have to do that. We are not going to do the acid fast stain, but there are a lot of stains. You have to remember what are the different types of stain, what stain is used for what type of thing, what is the counter stain. The gram one, you know, the first stain is crystal violet, counter stain saprophyte, and there will be other stains. You have to remember all those things when we use the acid fast stain. So we are going to do that from tomorrow, acid fast stain. Okay. Okay, have a good day. Bye-bye.
Thank you, Miss.
Bye.
Thank
Bye.
You.
Have a good
Bye-bye.
Thank
day.
you, ma'am. Thank you, ma'am.
Bye.
Bye,
Bye.
guys.
Okay, so I send you some review kind of notes with lot of answers on that. So you guys try to read that one, understand, and then you start working on your test review.
Yes, ma'am. Thank you.
Thank you
Yes,
so much.
miss.
Thank you.
Thank you very much.
So I give that's what I made it yesterday night during my night shift for this one, that review, and the notes. I had some before and then I collected, accumulated. So I send it. I don't know whether I'll be able to send it your final review or something, test 2 and final review. But at least in this review, and I'm going to send another review. I'm working on that MSQ. So probably on that you can cover the test 2 and test 3 informations if I cannot make your review. Okay.
Okay, thank you, miss.
Thank you, Miss.
Okay, dears.
Thank you, ma'am. I'll be
Okay.
online tomorrow, ma'am, but I will probably not respond to you. Thank you.
Yeah, me too.
Yes. And we will let you know
Okay.
when we're back.
See,
Yeah.
Evelyn and Asnet, both of you. You are not
Yes,
going to
ma'am.
do the mask fitting just whole day, right? The
Yes, ma'am.
No.
time
Yes.
when the
No,
time when they're going to put the mask, you cannot
that's
talk.
it.
Other
Yeah,
time you can talk. You may not be in the video, but you can talk.
Oh,
Okay, it's not like
that's
you
fine.
cannot talk.
yeah.
Yeah.
We'll be
Okay.
driving. We'll see, ma'am.
Yeah.
We can
Okay.
respond.
You're
Thank
gonna
you.
drive, go
But
there, and video for
you are
them.
not going to drive for 4 hours. It's a 4 hours
Yes,
class.
that's right. That's right, ma'am.
We'll be
I
And
back.
we'll be
yes,
back as soon as we
that's
can.
that the answer of a good girl.
Yes.
Thank you.
We'll go
Okay.
there and we'll fit our masks and we'll be
Yeah.
back.
And so we have to come
Right.
back. Moon is
We'll be back.
waiting. Moon is waiting. So we have to come back.
Thank you, Miss.
Okay,
Yeah.
okay,
Thank
okay.
you,
Bye
ma'am.
bye.
See you
Bye
tomorrow.
bye. Bye bye.
Bye.
Bye. Bye. Bye everyone.
And have
Bye.
a good night rest, ma'am.
Okay,
Yes,
I
get
am
some
feeling really
rest.
sleepy now. I am non-stop working. This is tonight is going to be 8 night in a row. Nothing is,
Oh, wow.
Wow.
I am feeling so tired.
Yeah, you need to take a rest, full rest.
Yeah, and my husband is in India, so everything extra works is also I have to do. Yeah. I'm feeling
Oh,
so
wow.
tired.
Miss,
Yeah.
take it easy.
Okay, okay. Thank you. Thank you, girls. Okay, thank you,
Thank you.
everyone.
Okay,
Okay, bye.
thank you. Bye, everyone.
Bye.
Bye.
Bye.